On August 28th, the Centers for Medicare and Medicaid Services announced $10 million in Navigator grants. Navigators are a function of the Affordable Care Act, assisters to help people navigate the Affordable Care Act's marketplaces. Now for 2020 into 2021, there were about 30 agencies across 28 states that will receive some of this Navigator money from CMS. These are the states that largely use the federally facilitated marketplace. States that run their own marketplaces were not eligible to request this Navigator money. Now, the consumer assistance piece of the Affordable Care Act is largely underfunded, but has become more important as we are in this critical COVID pandemic time. The Affordable Care Act requires Navigator programs. They come with state regulations, some federal regulations, but it looks different in 2020 going into 2021 than it did back in 2012, right before the first marketplace open enrollment started in 2013. For one thing, funding has been cut, almost 85% of what the original grant allocations were. And some of the rules are changing. It used to be you had to have a physical presence in the state so you could offer face-to-face assistance for people that needed help purchasing insurance, or at least learning their options for health coverage. That doesn't exist anymore. There's also scaled back training requirements and post-enrollment assistance. And the Trump administration has been gung-ho in promoting short-term plans, and they've instructed their navigators to make sure that they include that as an option when talking about considerations for coverage. So it's a different landscape than what we had before. We don't have a nationwide system of consumer assistance to help people across all of the different health coverage programs: Medicaid, Medicare, private insurance, COBRA rules, employer-sponsored insurance, all the myriad of coverage systems. The Affordable Care tried to chip away at that a little bit after some consumer assistance program funds were started in 2010. The Affordable Care tried to at least give navigators in the marketplace, and now we have a much scaled down version of that as announced by CMS in time for the next open enrollment period. There are 2 states that won't have navigators but use the federal marketplace: South Carolina and Utah. 2 states have decided not to apply for Navigator funding because they are switching from the federal marketplace to their own state-based marketplace, and that's the state of Maine and Virginia. The federal money is allocated to those remaining 30 states based on how many people have uninsured consumers. So those remaining 30 navigators across 28 states, that money will be doled out according to how many people are uninsured. And be ready to see some new Navigator agencies working in multiple states this year that we didn't have before. 2 consulting services called First Choice Services and HRS Race. This is part of getting ready for open enrollment that runs November 1st through December 15th, 2020. That's right on the horizon. This is for coverage that would then begin January 1st, 2021. As we get closer to that open enrollment period, we'll continue to bring you updates on what's new, what's different, what's the same, getting ready for open enrollment. We share in the description below the press release from CMS announcing these Navigator grants. You can see also the listing of Navigator agencies to find the one closest to you.